6 minutes.
Thank you, and I thank you very much for your hospitality and letting me join you today. Dr. Kassan, I wanted to ask, when was your last trip to Syria?
After we call it liberation of Syria, I visited Syria 4 times. Last one was in February, just more than a month ago.
So you've been there quite a lot. I'm quite taken by the fact that there's been a mental hospital opened in the north, because it's when you think about the kind of PTSD that comes out of war and out of the conditions that Syrians have been living under, and quite frankly that Syrian Canadians have been have also lived under, and the worry that people have for their relatives back home. Can you just tell us a bit more about that and what it's doing that's innovative in terms of treating the PTSD that comes out of the circumstances that people have lived through?
Thank you very much for the question. We have been focusing in our organization on primary health care and psychosocial support and mental health. As you said, more than probably 2 million children in Syria are suffering from severe mental health illnesses as per UN. So we took this initiative because we found in northern Syria there has been no single hospital for admissions. So we go to the tents and we try to support the children, vulnerable population with a psychosocial support. But a lot of them, they need admissions. They need ongoing medications. They need ongoing care in the hospital. So we started this hospital about probably 4 years ago. And we have admitted thousands of children into the hospital. A lot of them, they're out of the hospital now, and they are back to their villages and cities in Syria.
Well, it's always amazing how resilient children are, even in war. But how widespread is PTSD among civilians?
It is a huge. You'll be surprised, Honourable Member, that myself, I was victim of PTSD, both after coming back from Gaza and from Syria, and I needed psychosocial support in Canada. So if a physician goes to Syria for a week or two, or a nurse, Canadian nurse or a foreigner might need some treatment, imagine children and women that I remember one day I was in a hospital there, and it was safe and everything was fine, but the child was always hearing bombs constantly, and he could not sleep. So it is widespread, and I think it's way underestimated. But we need, and Canada has a huge, and pioneer expertise in mental health. And I think we can deploy a lot of help, not only funding, a lot of expertise and help by our great mental health specialists in Canada to treat thousands of vulnerable people in Syria.
What kind of treatments are available in the hospital that you've described in northern Syria, the mental hospital that you've started?
We started providing them with medications. During the war, it was only counseling. We did not have a lot of drugs that are badly needed for depression, anxiety, PTSD, and so forth. And now we have the ability even to provide deep depression, anxiety, some cases with electric shock and all these kind of methods to treat deep depression. And so we have even educated and trained nurses in mental health and psychosocial support. In Syria, unfortunately, there is a big lack, even from before the war, in psychiatry specialty. So that was an issue, and we were lucky to have a lot of psychiatrists, Canadian psychiatrists, volunteering online through the telemedicine to treat thousands of patients through online telemedicine to this hospital.
You made a comment near the end of your remarks around how important the next decade is within the Syrian context to be able to see whether Syria will truly be able to separate itself from the proxy wars that have really destroyed it, being waged by the likes of Iran and Russia, and the alternative. What are the consequences in your mind of not treating the PTSD that is so pervasive in war, in sort of post-war areas like Syria?
This is a very important question. A lot of workers, including my colleagues, nurses and doctors in Syria, in order to be functioning, in order to go back to the healthcare sector and be quite effective, we need to treat them. We always underestimated the healthcare workers that are impacted by PTSD. And every time I go there, I figure out that we need to focus on the workers first before even focusing on the patients. So I think a nation program focusing on all healthcare workers, talking about my specialty, would be very valuable in bringing them back to work and be more efficient. Otherwise, we're going to be missing a lot of healthcare workers in Syria.
You also made a reference in your remarks to this work really being meaningful in that you're getting to work with mostly women and children and really seeing the impact of the Assad regime in terms of humanitarian violations of international humanitarian law. Is there any joint work being done with the demographics that you're working with in to be able to also help pull evidence together and assist international investigators in doing the work that needs to be done there?
So we have been working with some groups, like even Muzna group in Syria. She was one of the witnesses in the morning. A lot of women, organizations in Syria, healthcare organizations, human rights organizations in Syria and internationally, in order to heal, all these wounds. And there has been some successful, but I think it needs a lot of funds and a lot of work going forward.
Thank you.
Well, thank you.